everybody. Welcome. This is Dr. Andy Rosenfarb, and we are coming to you live from here in New Jersey, and we have an exciting session for you this evening. We're going to be talking about macular degeneration, one of my favorite subjects. I have a lot of patients that I've been working with over the years, last 25 years with macular degeneration. And this is by far one of the most common conditions that we see, if not the most common ophthalmic condition that we see in clinical practice. So tonight we're going to go through a lot. We really have a lot to cover. And you guys, do me a favor, whether you're watching this on Facebook or you're watching the Zoom presentation, if you could do me a favor and just give me a thumbs up or something like that. Let us know that you can hear and you can see everything okay. That'd be really helpful. And also let us know where you're listening from or where you're watching from. We know we have acupuncturists, we have patients, we have just people who are interested, maybe you have family or friends who recently diagnosed with macular degeneration. I know we have a lot of healthcare providers, we have functional medicine practitioners, we have eye doctors, optometrists, ophthalmologists, retinal specialists joining us. So I really want to try to zoom out and try to pack as much content into this hour as possible for you without kind of diluting it too much and without packing too much in. So I'm tripping over my words, but we really do want to try to get the information to you guys. Yeah, I think it's going to be great. One quick, Blaine, if you could do me a favor, just look into the Zoom. I think we have the side by side. If you could fix that up, I don't know if you can or you can't, guys. Blaine is my my producer. If we could fix it so it's one screen instead of like the side by side, it looks like kind of I'm here and it's over there. So if you could do that, great. If not, then you're going to see a picture of me and me talking, which is great. So let me tell you a little bit about what we're going to be talking about this evening. Okay, obviously the conversation that we're going to have this evening is macular degeneration. We're going to start with an overview, a basic overview of macular degeneration. We're going to talk a little bit about macular related issues. Primarily on this call, we're going to talk about dry macular degeneration and wet macular degeneration. Now we know there's other conditions like macular puckers, cystoid macular edema, a whole host of maculopathies that can happen. We will be doing more detailed sessions on things like macular holes, macular puckers, CME, cystoid macular edema, CSR, central serous retinopathy. So any of these other related issues. Last session we did on retinitis pigmentosa, we covered Stargardt's. I'll mention a little bit about that tonight as well. But again, primarily tonight, we're going to be focusing on wet and dry macular degeneration with some mention of the other conditions. Then we're going to talk about the causes of macular degeneration, the real underlying causes, and the contributing factors that can accelerate this condition. Then we're going to talk a little bit briefly about the limitations rather of conventional biomedicine and some of the sticking points and why what we're looking for in terms of biomedical treatment, pharmaceuticals, stem cell gene therapy, biotechnology, stuff like that, nanotechnology. Then we're going to talk a little bit more about, again, a little bit of a deep dive into the underlying cause of macular degeneration and the driving factors behind it. Then we're going to talk more about supplements, diets, lifestyle. We're going to get pretty into carotenoid antioxidants and macular pigments. Then we're going to talk a little bit about ophthalmic acupuncture, some of the treatment modalities we use, ophthalmic acupuncture, microcurrent, alternating current stimulation, hyperbaric, oxygen therapy, and then we're going to dive into Q&A. So if you guys want, feel free to ask questions in the Q&A button that we have for you guys. So just punch them in there. We'll probably go a little over an hour this evening. Again, I want to make sure we get through the content, and I want to try to get as much as your questions as possible, because I know you guys have a lot of questions, and we want to make sure that we can do that. So that is the agenda for this evening. And again, for those of you guys who just logged in, I am Dr. Andy Rosenfarb with AccuVision Acupuncture, where your vision is our mission, which is why we're here with you tonight talking about macular degeneration. So real quick, my goal when I work with patients, if we zoom out for a moment, whether it's macular degeneration or any other condition, is very simple. Our goal is to try to recover whatever lost vision we can, and we can do that. And we're going to talk about how and why we do that, and then help you keep the vision you have, right? So we want to try to recover whatever vision we can. And then once we've recovered whatever we can, whatever vision you can recover, we want to at least help you stabilize and keep that vision, or at least dramatically reduce the degenerative process. And we know how to do that. And you guys are going to find out tonight how and why we do that. So without any further ado, let's talk a little bit about macular degeneration. Now, you guys know macular degeneration is a disease of the macula. So let's talk about the macula first. So in the eye, we have the retina, okay? The retina is the very thin photoreceptor layer. Photoreceptor is the nerve layer, okay? Photo, light, receptor to receive. So these are cells, nerve cells in the eyes, in the retina, that pick up light, send it to the brain, specifically the visual cortex, by means of the optic nerve to help us see. All right. Now, in the retina, we have two types of cells. There's rod cells and there's cone cells. The rod cells are generally in the more peripheral vision. As we talked about last week with conditions like retinitis pigmentosa, those are more responsible for your night vision, your contrast vision, your peripheral vision, and your dark adaptation. Your macular cells are the macula area is your cone cells. Those are different cells. Again, we have rods and cones. The cone cells concentrate. They're concentrated in the central part of the retina, okay? And again, what the retina looks like, to give you guys a little reference, if you've ever cut a tennis ball in half and you see the rubber lining of the inside of the tennis ball, that's kind of like how the retina lines the inside of the eye with the photoreceptors. Okay, so we have the rod cells and the cone cells. The cone cells are where the macula is. It's a concentration, and even more concentrated inside the macula is called the fovea. The fovea is the highest concentration of cone cells. And what do these cone cells or the macula do? Glad you asked. The macula is specific for our sharp, detailed HD high definition vision. All right, our central vision, our acuity, our very detailed vision. All right, this is what we use when we're reading, when we're basically using most of our vision. When we're reading, we're looking at people's faces. Any fine specific details that we can see are the result of the functionality of our cone cells in our macula. Now, in macular degeneration, what happens is this area starts to degenerate. These cone cells or macular cells start to break down and lose function. And loss of function, as we talked about earlier, means that they're not picking up light signals, or the light signals are bouncing around. It's not in what we call a coherent state, where the light images go in, hit the retina, are converted from light or photons to electrical chemical potentials and sent to the brain via electrical impulses to the visual cortex to make sense. All right, that's pretty much how the visual system works. Now, with macular degeneration, we have a progressive breakdown of this area of the retina called the macula, which starts out with an accumulation of what's called drusen. All right, so you have a buildup of these fatty deposits called drusen. And we're going to talk a little bit more about drusen and what this looks like. So drusen is the predisposing factor, or how we identify macular degeneration. And how will your eye doctor see this? All right. So what this looks like is you may or may not have visual disturbances. You may go to your eye doctor and they may do either a picture of the back of the eye where they dilate your pupil. They look at the back of the eye, which is called a fundus image, right? They take a picture of the back of the eye, and they may see little yellow or white specks. These are mostly fat, but they also have some protein and calcium in them. It's very similar to plaque or cholesterol, okay? So they will observe the presence of this drusen. And we could also do another test called an ocular coherence tomography, which is a cross section of the macula. And inside that, we could start to see little bumps, okay? And these little bumps are, again, a cross section that show us the presence of drusen. Now, you can start to have drusen early stages and not necessarily have vision loss or vision distortions. Early stage macular degeneration, or people dealing with macular degeneration early stages, will usually start to see wavy lines or slight distortions. So if you look at like vertical blinds or a grid like graph paper, one of the tests we use is called an Amsler Grid, which is basically graph paper. And we look to see if there's any distortions, any waviness, any missing lines. Why? Because the light is coming into the eye, and instead of hitting the back of the eye or the retina, it's kind of distorted because it's bouncing, the light rays are bouncing off the drusen, and it's not, again, a coherent, clear signal or photon energy that's getting to the eye. So the vision will start to distort in the central vision, and it'll start to be like, you kind of see something, it's a little wavy, it's a little distorted, or you'll start to see patches in early stage. As macular degeneration develops and advances, the central vision will start to go. So you won't be able to see my face. You could see what's around me, but this area you won't be able to see. So a lot of times you'll see people with progressed macular degeneration starting to look, they have to see out of their peripheral vision. So they'll start to kind of look up and down or kind of do this type of thing to see if they can use part of the peripheral vision because they can't use their macula or their cone cells. Okay, does that make sense? So this is what we call dry macular degeneration. All right, we have the presence of drusen. Dry type macular degeneration, or non-exudative type, that's what we call it, is just means that there's no bleeding. So when we have wet macular degeneration, which we're going to talk about how that occurs in a minute, is the presence of bleeding. So we have what's called neovascularization, or new blood vessel growth, and we're going to talk about why that happens. And these new blood vessels are very weak. All right, they're weak and they're fragile. They're not as strong as the original pipes in our eyes, the blood vessels. Okay, these are new blood vessels that are very weak and very fragile, and it's kind of like, if you think of like the main original blood vessels in the eye, like PVC piping, very strong, very tough, can handle some wear and tear. The new pipes are like tissue paper or, or glass. They don't have that flexibility or durability, so that they can rupture. All right, they can rupture and cause bleeding. And then when we see the presence of bleeding, we know for sure that there's wet macular degeneration or wet type exudative macular degeneration. For sure, that's a medical emergency, and that's when we go to our retinal specialist or ophthalmologist. They'll probably give you an injection of something, one of three injections of medications: Eylea, Lucentis, or Avastin. Those are one of the three injections you'll get. Those are anti-VEGF. What they do is they try to inhibit the endothelial growth factor, or the generation of the new blood vessels, but they've also been very effective at absorbing the blood. So when there is a bleed, guys, we want to get the blood out of there as fast as possible, because iron oxidizes really fast and it's very inflammatory. And if it sits there for a while, the protein can build up. Iron oxidizes in the blood, so it can accelerate cause some damage in the eye. So we want to get rid of the fluid, in this case, the blood, as fast as possible. And in these emergency cases, for sure, injections of Eylea, Avastin, and Lucentis are indicated. Now, we're going to talk about the benefits and where the limitations are. So we want to talk a little bit about that as well. So let's talk a little bit about, zoom out and talk about like what causes macular degeneration. Then we're going to circle back and talk more about specifically the wet and the dry type. And I want to talk a little bit more about the injections and the limitations and how they work and when we recommend them. In most cases we do, but there is a false sense of security around the injections that we're going to talk about in a few. So macular degeneration, why do you get it? All right, too old, that's why you get it. Bad genes, won the lottery, Why? Why do you get macular degeneration? Well, the truth is there's really not a lot of known causes. There are risk factors that conventional biomedicine tells us about based on research, things like smoking, um, things that cause oxidative stress, a lot of direct sunlight. We know from we have macular degeneration, we're told to wear glasses to prevent the UV radiation, but there's not a lot of real understanding other than knowing about some of these risk factors, which in my opinion is why there hasn't been any great advancements in terms of treatments. So I'm hoping, I know we have some retinal specialists and Western conventional biomedical doctors who are with us this evening. So one of my hopes is that maybe you guys will hear some things that might jar some more questions and start to connect some dots for you guys. Because I have a lot of really, really good friends and colleagues who are retinal specialists, ophthalmologists that we have these conversations before. And, of course, I value their experience and their education, but I have a different perspective based on my 25 years of experience of working with, thousands of eye patients that I can bring to the table, and different perspectives based on functional medicine, naturopathic medicine, Chinese medicine, and just my clinical observations. So those are the types of things I want to share with you guys. So the biggest factor that I found based on my experience dealing with patients with macular degeneration is this. My clinical experience has led me to this point in time to have a very strong, firm belief system that macular degeneration is a branch of cardiovascular disease. And I've been talking about this for the last at least 20 years. We've been talking about this. So those of you guys who've been following me have heard this before, but we're going to talk a little bit more about the specifics and what that looks like this evening. So what does that mean? So we know what cardiovascular disease is, right? It means increased risk of stroke. It means we have increased risk of heart attack. It means that we have, just an increased risk of strain and stress on the heart. The heart's working hard. Often there's things like plaque and cholesterol around the heart that makes it hard work, or we have arterial plaque and atherosclerosis. It just means that the heart has to work harder to deliver the blood and oxygen to all the cells of the body, right? We know that as humans, we are totally dependent on oxygen, oxygen to breathe, and blood sugar for food. We need to breathe, we need to eat. So without oxygen, we can't survive. All of our cells are the same way. Every cell needs oxygen, okay? So if we have impaired blood flow to certain parts of the body, it's going to reduce that function, and eventually we're going to die if there's oxygen deprivation. So we start to see a lot of similarities between macular degeneration, we're talking about dry type right now, and cardiovascular disease, right? We see circulatory issues, meaning that there's poor blood flow to the macula, right? We have hypoxia. We have lack of nutrition to the eye. Why? Because they're clogged, right? We have our blood vessels, our microcapillaries to the eye, all around the eye and throughout our whole body. They're pipes, guys. They're tubes. The only way tubes and pipes don't work is two ways. They break, almost like a pipe breaks. It gets rusty, it gets old, either through trauma or degeneration, or it gets clogged, right? So the pipe either breaks from acute trauma or degeneration, or there's a clog, either protein or fat or cholesterol or plaque or something like that. So what happens is that obstructs the blood flow to the eye. In this case, we're talking about the macula and the retina. So as the blood flow reduces, function decreases. Less oxygen, less glucose, blood sugar, which is what the cells run on, and raw materials for repair and regeneration. Also, you're going to have an accumulation of carbon dioxide and ocular waste products, which is what we know drusen is, right? So it's the flow. That's the first concept I want you guys to be aware of. And those of you guys who were on last week's call know that we've talked about that the retina is the highest oxygen consuming tissue in the entire body. Some of you might not have known that. That's right. The retina consumes more oxygen than any other tissue in the entire body. What that means is any loss or when the retina when the retina is deprived of oxygen, it's going to lose function. It's going to be very stressful, and it could cause problems. So lack of oxygen, or hypoxia, as we call it, is a huge factor in macular degeneration. It's huge. Okay, so we need good blood flow. We need oxygenation. We need good circulation. We need delivery of glucose and cellular nutrients to the eyes, micronutrients, macronutrients, protein, amino acids to rebuild, so on and so forth. We also need to get rid of carbon dioxide and metabolic waste, which we know is not happening because we see the drusen accumulating. Second thing, okay, so the first in the perfect storm to set up for macular degeneration is this circulatory issue. The second thing is inflammation, all right? That is something that's being talked about more and more when it comes to macular degeneration. We know, just like cardiovascular disease, inflammation is a huge driving factor. It breaks down the blood vessels, it cooks all the cells, it's damaging, right? It damages the cells if there's too much inflammation, right? It starts to, too much heat starts to break down the tissue. It starts to attenuate the blood vessels. The blood vessels start to break down. The nerve cells start to break down. The whole neurovascular system starts to break down in the same way that with chronic inflammation will set us up for a heart attack. And there's a lot of literature that we talk about now, specifically in functional medicine, that talks about that cholesterol, high cholesterol triglycerides are not the primary source of heart disease now. They're kind of secondary to inflammation, oxidative stress, which is the third thing we're going to talk about. So inflammation is the real thing we want to watch here. Like, we really want to watch inflammation. That's really what we're concerned about here, because the damaging effects of unchecked or unmanaged or uncontrolled inflammation is catastrophic for the vascular system, the neurovascular system, which of course is related to the eye. The third thing I wanted to talk to you guys about with this factor that creates this perfect storm for setting up this ocular, vascular, cardiovascular situation, the eyes, is oxidative stress. Oxidative stress is accelerated aging, okay? Oxidative stress is when free radicals, which are basically molecules with unpaired electrons, they go around and they're trying to steal electrons to neutralize themselves. All right. What they do is they damage healthy cells when they're trying to do this electron steal. And when they steal the electron, it damages healthy tissue, and the tissue will get sick and start to break down. Okay. So the effect of that process is accelerated aging. So people with high oxidative stress have an older retina. The macula is older, it's aging faster. And we know that things like smoking, drinking alcohol, sedentary lifestyle, pollution, all these factors junk food will accelerate oxidative stress or cause more oxidative stress and progressive degeneration. So managing circulation, specifically hypoxia and blood flow, and detox pathways from the ocular system, inflammation, oxidative stress are all these factors. When we have inflammation, poor blood flow, and oxidative stress, that is the perfect storm. You add genetic predisposition to that and lifestyle factors like smoking, sedentary lifestyle, too much alcohol, eating too many trans fats and garbage, like fast food, processed food. Guys, you're setting yourself up for that, for an unhealthy state. And if you have cardiovascular disease in the family, you're even at greater risk to get macular degeneration, because they're very, very closely linked. I would say 70% of my patients with macular degeneration, at least 70%, either have comorbidity of cardiovascular disease, meaning they're on antihypertensives for high blood pressure, they're on blood thinners, they've had stents put in, they've already had a heart attack, there's some cardiovascular issues going on, or they have a family history when they're kind of younger, maybe in their 40s or 50s, and it hasn't really manifested yet. So that is the perfect storm. And again, add poor lifestyle to that and not really taking care of yourself. That's there. So guys, when we say like we don't know, or when you read stories, we don't really know what causes macular degeneration, that's not true. Like, we know that all these underlying factors can absolutely set you up for macular degeneration. And especially if we have the genetic testing now that a lot of people are doing, where you can actually see if you have a genetic predisposition to this. So again, the value of that test just lets you know that, hey, I got to take better care and we need to take some supplements or do some lifestyle adjustments that we're going to talk about in a little while to help you mitigate the probability of having to deal with macular degeneration or neurodegeneration, neurovascular degeneration. Okay. So what I really want to talk about with that, I want you guys to just understand that this is a breakdown of the vascular system that affects the nerves. So it's a neurovascular dysfunction, more specifically, an ocular neurovascular dysfunction that is rooted in a systemic cardiovascular dysfunction. Yes, macular degeneration is a disease of the eye that is rooted in systemic cardiovascular neurovascular dysfunction. Okay. So this is one small part that's a reflection of the bigger picture of what's going on. So by that, when we start talking about ways to help these situations in preventative strategies or treatment strategies, it may not be too far-fetched for you guys to understand that anything that is going to be heart healthy, meaning that it's good for the cardiovascular system and heart disease, is going to be good for macular degeneration. So even if you guys are following a heart healthy diet, you're doing exercise, anything that's good for your cardiovascular system is going to be good for your macular degeneration. Pretty cool, right? So the vascular system alters and starts to degenerate because of a lot of factors, right? Environmental pollution, toxins, chemicals, processed food, poor sleep, sedentary lifestyle, genetically modified foods, junk food, sometimes vaccines, and we're going to talk about that in a second as well. I don't want to get too much into the COVID conversation, but I'm going to make one mention of it just so you guys should understand. Things like leaky gut, autoimmune conditions, certain medications can be pro-inflammatory, cause oxidative stress, etc. So there's a lot of factors here. The one thing that I do want to talk about COVID and the vaccines, and this is neither a conversation for or against, it's just information here, is that we know that the coronavirus, which at the time we are doing this presentation in May of 2021, we are dealing with the COVID-19 situation. And we know that coronavirus has three major effects on the body. We know it causes blood clotting. We know it causes cytokine storm, which is inflammation. And we know the end result is hypoxia as a result of those factors. Now, does that sound similar, or it might amplify cardiovascular disease? It does. And we know that the problems that people have had, i.e. those that are more susceptible to having problems or having, a hard time with COVID or the COVID vaccines, are people who have underlying cardiovascular disease. They're overweight, they're diabetic, they have cardiovascular disease, they have high cholesterol, high blood sugar, so on and so forth. We know this. Research has already come out. This is nothing new. I am not making this up. It's already been documented that people who are in cardiovascular, have that as a comorbidity, are at greater risk for having issues, even things like death. So that is something to be concerned with, okay? So if you have COVID, the reason I'm saying this is if you've had COVID or you have had the vaccinations, because very few people are going to have side effects, but some of the side effects that we've seen are going to mimic COVID: blood clotting, inflammation, and we've all seen our immune system gets activated, and hypoxia. So just keep in mind that if you've had COVID or you had a vaccination and your specific system or situation is starting to see some, if you have macular degeneration, you see an acceleration of that condition, it can be due to either COVID or the vaccine. And that doesn't mean you're screwed. It doesn't mean there's nothing you could do. It means that we have to do some work to manage the inflammation and manage the hypoxia and manage the oxidative stress so we can reduce the vascular stress, the acute vascular stress that's going on. And everything I'm going to talk about over the next half hour or so that is related to therapies that you can do can be used in those circumstances. All right. So any of the supplements we talk about, the lifestyle things, recommendations we talk about will definitely be things that will help you if you are in that situation. And if any of you guys, family or friends or anybody is in that situation where you've had COVID and have or had the vaccine and you're seeing issues with your eyes, again, feel free to reach out to me. If you're seeing dramatic changes for the worse, please reach out to me. There's a lot you can do, and I'll be happy to go over with you specifically as per your case and what you could do to help deal with that, because there is nothing right now that conventional biomedicine has for that, for either even long haulers. People have like COVID long haulers for a while. Okay, that's all I'm going to say about COVID. The next thing I want to talk about before we get into treatment and treatment strategies is I want to talk a little bit about wet macular degeneration. Okay. Wet macular degeneration, as we talked about, is the presence of bleeding. And the bleeding occurs because we have what's called angiogenesis or neovascularization. Two real fancy words, just meaning you have new blood vessel growth. Now, very, very, very important for you guys to understand why we have this new blood vessel growth. Okay. So we go to the eye doctor, we have a retinal specialist. We've been diagnosed with macular degeneration. We lose vision. We freak out. There's an acute episode where you now have wet macular degeneration, and doctor says, okay, we have to do an injection to stop the bleeding. You're going to come like every 2 weeks or every 4 weeks or every 6 weeks or every 8 weeks as you progress. Okay. So the object of the injections is to get them to absorb the blood. Talked about that earlier. We don't want blood sitting in the eye for very long. We want to get it out as fast as possible because that blood can oxidize. It can start to coagulate. That's what blood does. Blood clots. So we don't want it forming a clot because it's harder to get out. So while it's in liquid phase, we want it to get it out as fast as possible. Okay. Now let's back up for a minute here and talk about why would the body grow these new blood vessels? Okay. Let's go systemic for a while. Okay. There's one other part of the body that does this same thing, has the same process called angiogenesis. And those of you guys who are students of mine or those physicians for sure will probably know the answer to this. It is the heart. Okay. Your heart has new blood vessel growth, can have angiogenesis. Why? It happens during cardiovascular disease when you have things like congestive heart failure, increased cholesterol or plaque around the heart, and the heart needs oxygen, right? The heart has constantly pumping, so it needs blood flow. So the body will grow these new blood vessels around the heart to oxygenate it because the main pipes are clogged. So the body says, shoot, got to get oxygen to the area. So it'll grow these new blood vessels to deliver blood to the heart. Again, the blood vessels are not as strong as the original ones, but the body's like, I don't care. Heart needs to keep beating, need to get oxygen. Don't get oxygen, gonna die. Die, not an option. Okay. So we'll see angiogenesis happen around the heart. We'll also see it, of course, we'll see it around the eye. And again, what can become wet macular degeneration. So when we start to see the presence of neovascularization, meaning the new blood vessels grow around the macula, what that information is telling us is there is already a state of hypoxia without question. Why? Because the body wouldn't grow them if it didn't need it. The body doesn't just screw up. And it's not just like, oh, it messed up and it's growing these blood vessels. It's not. It's deliberate, specific, and intentional in what it's trying to do. And what it's trying to do is grow these new blood vessels to get more blood supply, more oxygen, more food, more nutrients, as long as the detox pathways of metabolic wastes and carbon dioxide, right? It wants to maintain circulation to the retina to maintain optimal health. As we mentioned earlier, these new blood vessels are weak. They're not very strong. So what happens is they grow and they're weak. So you get a cold, you drink too much alcohol, you sneeze, you bump your head, your blood pressure goes up, anything that increases the blood flow or is like slightly traumatic can cause a rupture of these blood vessels, right? Then you get a bleed. So then the treatment, of course, you know, the conventional biomedical treatment, which is useful and appropriate, is to do the injections, right? Probably about 10 or 15 years ago, the only use for these injections were emergency. You know, most of my friends and colleagues who were doing these injections were doing them on an emergency basis only, meaning the injections were given and then they were only used for a period of time until the bleeding stopped. Now we know, of course, for those of you guys who have wet macular degeneration, the injections are used pretty much ongoing as a way to prevent. That's what the anti-VEGF is. It's designed to destroy or reduce the genesis of these new blood vessels. Now, there is a problem with that. Okay, I do have a problem with that. I don't have a problem with the injections. My problem is with that you are giving a false sense of security. Let's back up and I'll talk about why. So if the body is growing these new blood vessels because there is poor blood flow due to the breakdown of the microvasculature in the eye, either it's traumatic breakdown or degenerate vascular degeneration, or the blood vessels are clogged, right? Protein, cholesterol, plaque, whatever is causing that impaired blood flow. For whatever, remember we said the retina is the highest oxygen consuming tissue of the body. The body has to get oxygen to the eyes. So the body's going to grow these new blood vessels. The body, they're going to have blood vessels burst. We're going to use injections. But guess what, guys? Even if you're getting the injections, have you addressed the need for more oxygen to the retina? No, you have not. So although you're dealing with the wet situation, the wet macular degeneration situation, which is the bleeding, and you're doing the injections to help reduce the growth of new blood vessels, the macula still doesn't have the blood flow and the oxygenation and the nutrients that it needs. So it is what? It is going to starve and it is going to suffocate. That's what happens. So you're doing the injections, you're controlling the bleeding, but you're still continuing, your vision is continuing to decline. And I hear every week, Doc, I've wet macular degeneration. I'm getting the shots, but my vision keeps declining. Why? Glad you asked, because your eyes are still suffocating and starving because you don't have good blood flow. And we talked about earlier, blood flow, inflammation, oxidative stress. Blood flow is one of the key factors. We don't have good blood flow to the eyes. Over time, it's very likely that the eyes grow new blood vessels. Okay. So that is important. That's important for you guys to know. So the point is not to make you guys think that these injections, the anti-VEGF or injections are not useful, safe, or relevant or appropriate. It's just not, it's a part of the puzzle. It is not going to cure. It's, in my opinion, the term used as treatment for wet macular degeneration is not entirely accurate. It is a treatment to manage bleeding and neovascular degeneration. It does nothing to support the health and function of the macula. It doesn't, right? So let's just be clear about what that is. Okay, so now that you guys understand the wet type of macular degeneration, why that happens, and it's the lack of oxygen, let's talk a little bit more about treatment and how it works and what you guys can do. So our treatment that we do is, the term I kind of use for our treatment is it's like CPR for the eyes. We talked about the eyes being like an ocular cardiovascular disease. So we know that when we have progressive cardiovascular disease, it ends in either a stroke or a heart attack. You can't have an eye attack, but you can have strokes in the eyes, of course. But the eye just won't stop working, stop pumping blood. It's not a similar situation. But we will see progressive degeneration, accumulation of drusen, and progressive macular breakdown, loss of function. So the treatment is designed to wake up the dormant cells, increase the blood flow, manage the inflammation, start to help break down the drusen through the detox pathways to help the liver get the enzymes out there and the bilin and the factors that are needed to convert these fat-soluble waste this protein and cholesterol plaque that's in the eye, help the body to convert that from a fat-soluble waste to a water-soluble liquid to break it down and get rid of it. All right, that is the game. I believe that in the near future, nanotechnology is going to come up with some deliverable way to bypass the blood-retinal barrier to get some enzyme activity or bile, or maybe some type of, detox through the detox pathways to help break down the drusen and get rid of it. We need to assist the Bruch's membrane in its ability to break down and get rid of the waste. It's not doing its job. Okay, I'll back up for a minute. The Bruch's membrane is the part of the eye inside the retina that helps the body break down and get rid of the drusen. It's kind of like the large intestine or the colon of the eye, if you want to kind of look at it that way. So how do we manage this? We look at things like helping improve circulation to get oxygen blood flow to the eye. We want to control inflammation. We want to reduce oxidative stress. We want to reduce oxidative stress through radiation, right? The primary external sources of oxidative stress are blue light and phones, computers, right? Blue light comes off these devices. Blue light is very, very, very stressful to the retina, especially stressful to the macula, all right? How many hours, especially with COVID, right? How long are you guys spending on your screens? How many hours a day are you spending on your screens? A lot. So this is new, guys. Over the last decade, right? We've been on screens and phones all the time. Our biology has not caught up with technology. So there's going to be a price to pay if we don't take care of our retinas. All right. So protecting our eyes from blue light and UV radiation. We know about UV radiation, wearing sunglasses. We do that blue light also comes from the sun. But these two big radiations I'm talking about are blue light and UV light, okay? UVA and UVB. Again, we also want to support the detoxification pathways that we just talked about, specifically the lymphatics, the liver, the phase 1, phase 2 detox pathways. Guys, you got to be pooping. You got to be going to the bathroom. If you don't go to the bathroom every day regularly, the liver backs up, the lymphatic system backs up, and we're going to have accumulation of waste product in the body. So we really look systemically. Guys, we are working with your eyes, but your eyes are related. They're connected to your whole body. So we have to help your body to help your eyes, right? This is holistic integrative medicine. Yes, we want to help your eyes, but we're not going to get there just by working on the eyes. We have to take a holistic systemic approach. Okay. We also look at lifestyle. We want to look at, again, a heart healthy diet. We want to improve exercise, the benefits of exercise on the cardiovascular system or the ocular vascular system. I mean, go through PubMed or Google Scholar. The volumes and volumes and volumes of research showing how the specific ways and mechanisms of action of how this exercise can help cardiovascular disease, or in this case, ocular vascular disease. All right. Again, protection against oxidative stress. Specifically, we use carotenoid antioxidants. All right. Carotenoid antioxidants, lutein, zeaxanthin, mesozeaxanthin, astaxanthin, vitamin A, retinol palmitate, leafy green vegetables. Okay. Yellow vegetables, pumpkin, squash, yams, stuff like this. So carotenoid antioxidants are a specific form of antioxidant that helps support macular pigment. Okay, macular pigment is what helps keep the maculas healthy. So it's so important. Carotenoid antioxidants are so important to your vision that we actually test them in our office. We have a device that comes in. Our patients actually can get a quantifiable readout of their carotenoid antioxidant score. And those of you guys who are patients of ours, you know what I'm talking about. So our patients come in, we test their carotenoid antioxidant values, and that lets us know what do they need in terms of supplementation. If they're low in carotenoid antioxidants, we know they're high oxidative stress. It not only is going to affect the eye, it's going to affect the heart, it's going to affect the skin, because carotenoid antioxidants also protect against skin cancer. All right. They also protect against cardiovascular disease. They also have a big protective against brain issues and brain oxidative stress, Parkinson's, dementia, Alzheimer's, stuff like that. So For all intents and purposes, these carotenoid antioxidants are one of I'd say they're in my top 3 in terms of importance for protecting the macula, specifically against blue light. So you guys are on your computers, you're on your phones, you're on watching TV, your blue light exposure. Guys, you have to take, even if you don't have macular degeneration, if you're using screens, you really should be taking carotenoid antioxidants. All right. Again, lutein, zeaxanthin, vitamin A, retinol palmitate, so on and so forth. Okay. We talked a little bit earlier about risk factors. Again, heart disease, diabetes, thyroid issues. Guys, these all create more fats in the body, right? There's a fat metabolism issue. We're going to create more cholesterol, more triglycerides, more low density lipoproteins, plaque. We're going to get more fat in the vascular system. The body doesn't like it. Why? Because the heart has to work harder, right? More fat, more cholesterol, more plaque in the peripheral cardiovascular system. It's going to localize also in the eyes. Very, very likely to do so. So what can you do? All right, we got all that. You know what macular degeneration is. What can you do? You know, you go to your eye doctor and they tell you, okay, well, take AREDS. You know, AREDS is a formula that's been researched that has vitamin A, C, E, zinc, selenium, and now the AREDS 2 added lutein and zeaxanthin. But that's not enough. All right, so you have Ocuguard and Preservision, or various forms of that. It's not enough, but that's all we have. All right, there's okay. Well, here, take your AREDS and, you know, come in every 6 months to a year, and we'll tell you how fast you're going to lose your vision. We're just going to track it. What can I do? Nothing. There's nothing else. But there is, and we're going to talk about that. There's a lot beyond the lack of you know, what biomedicine, conventional biomedicine has available to you. So again, we talked about diet. All right, we talked about diet as being very important. Exercise being really important. Anything that's heart healthy. Guys, we want to have more proteins, more vegetables, reduce animal fat. We want to have a lot of fiber in our diet, a lot of fruits and vegetables, a lot of berries. Berries are a great source of carotenoid antioxidants. Blueberries, blackberries, raspberries, bilberries, all the berries are really, really good source of antioxidants, specifically have these carotenoid antioxidants that help the vision. So what I like is I have people do a green smoothie in the morning, right? Throw berries in. The other thing with vegetables is you want to add beets, right? Beets are really important for nitrous oxide. And we know that that's really important to help vascular function and circulation. So if you're doing your smoothies, your drinks, throw some beets in there. Very, very important. Nitrous oxide, really, really important for vascular health. When you're on your screens, your computer, your everything, if you're going to be on for more than like 15 minutes, guys, go on Amazon, get your blue light glasses to protect. Set your phone to blue light protection, which is night mode, and protect your eyes. All right. Outside, UV protected glasses. The ozone layer is not what it used to be, guys. So we need to protect. Okay. Supplements. We talked about the ARED supplements. We talked about carotenoid antioxidants. We do the testing for that. Also, Resveratrol, one of the single most important nutrients for your eyes. Resveratrol helps break down drusen, plaque, and cholesterol. Take a little sip here. Flavonoids, like vitamin C, okay? Omega-3 DHA, fish oil if you can handle that. If it repeats on you, or you're vegetarian or vegan, you may want to go with flaxseed oil. That'll work just as well. Also CBD, cannabidiol. Our product is Canavision. Guys, we are seeing such incredible results with Canavision. Why? Helps increase blood flow, helps reduce oxidative stress, and it is arguably the absolute strongest naturally occurring anti-inflammatory right now. It pretty much mimics a steroid without having the negative side effects. It's so powerful as an anti-inflammatory. So for cardiovascular disease, I have all my diabetic patients on it, cardiovascular disease. The CBD right now is definitely up there with, it's in my top 5. And the top 5 is, again, some carotenoid formula, resveratrol, omega-3 DHA, and a CBD product. Okay, those are the most important. So eye exercise. We have our eye qigong exercises. Okay. If you guys don't go to our website, we have information on the eye qigong exercise. If you have my healing your eyes in Chinese with Chinese medicine, we have all the eye exercises you can do. Do your eye exercise. It helps with the lymphatic drainage and the muscle toning, keeps your eyes in shape, right? We exercise every day to keep our bodies in shape. We want to exercise our eyes as well. Okay. Acupuncture, ophthalmic acupuncture is a way that we use to help vision. All right. We've done research on this. The original research we did was in 2014 with Johns Hopkins University was the original study. Then we did another study funded by the NIH through Nova Southeastern, where we showed that without question that acupuncture increases blood flow to the eye. We measured with ultrasound and ocular Doppler, and we know without question that it increases the blood flow to the eye. And we know that the supplements with help oxidative stress. And what the acupuncture does too is it stimulates, we talked about it, it causes vasodilation. So it stimulates the blood flow to the eyes. It also wakes up the dormant retinal cells, all right? So a lot of the retinal cells will lose function. They're not dead. And we know that because we've seen improvement on visual fields. Usually always rather, when a photoreceptor or any nerve cell dies, it's gone. If it comes back and we see a restoration of function or regeneration, that means it was in a dormant comatose state. And the degree of vision recovery that our patients have are in direct proportion to the ratio of dormant to dead retinal cells if you have vision loss. So patients who recover a lot of vision are recovering vision because there was a quantifiably relative more amount of dormant cells relative to dead cells, if that makes sense. Also stress management. All my patients, all of them, I've heard for the last 25 years, doc, these two things I hear all the time. My vision gets worse when I'm stressed out, and my vision gets better when I exercise. Again, we have so much research that talks about why and how, and we're going to, in another session, we'll get a little bit deep into the actual physiology and causes of why that actually happens. We don't have enough time to get into that right now, but again, exercising, managing stress is critical. Guys, stress has such an incredible impact on the neurovascular system, the eyes, all right? It does. Like the more stressed we are, the more we're going to accelerate aging, all right? We're going to accelerate our vision loss, in this case, macular degeneration or anything else, all right? The other cool thing about acupuncture is it stimulates the release of stem cells, right? We know stem cells are a big thing for a lot of people. So acupuncture and hyperbaric, which is another therapy that we're using, I'm going to talk about in a second, increases the only two therapies that we're using right now that have been shown scientifically to increase endogenous production and distribution of stem cells to the eyes. Hyperbaric therapy is the other therapy that we've recently been using in clinic. Hyperbaric means we're increasing oxygen to the eyes. Why? Of course, we talked about that. The retina is the highest oxygen consuming tissue of the body, thereby using treatments that are helping more oxygen get into the body, in this case, the eyes, are going to be beneficial. All right. We know that part of macular degeneration is due to hypoxia. Okay. So that's what we can do. And so what next? Like, what can you guys do? Glad you asked. So there's a few things you can do. You can go to our YouTube page or go to our websites. If you're interested in learning more about this, we have so much free content, just like this talk. On my YouTube page, I have specific videos about the different treatment options that we have, the different treatment modalities. We have patient education lectures that talk about the deeper dive into the treatment specifics on the treatments we do and how that works, which is great. So that's one thing. You guys can like just troll through our free content on YouTube, on our websites, articles we have published. You can look at our research. Then if you're more interested, you can look at our books, right? I have 6 published books on eye diseases. We have a book specifically On Amazon, that's 99 cents on Macular Generation, Acupuncture and Macular Generation, that explains how acupuncture works for macular generation. So that's the next level. You guys can start educating yourself or continuing to move forward with self-education to understand your condition better and what you can do to empower yourself. Then, if you're ready to start looking into supplements or eye exercises, that's something you might want to invest in as well. We have our website called Eye Health Institute, right? Eye Health Institute, EYEHEALTH institute.com. That's where we have all our supplements. We sell our books. And yes, our books is on Amazon as well. So you can start getting into supplements. We have there supplements listed by condition. So we have a starter pack right now for macular generation that is a list of all the supplements that we pretty much recommend for macular generation. Again, CBD, resveratrol, the supplements with the carotenoid antioxidants, omega-3 DHAs, all these things that we know that we talked about that are really good for your vision, okay? The next step would be to maybe you're in other countries or travel is too difficult for you. You might want to do a telehealth consultation. We do a ton of those. We've done a lot more over COVID, but reach out to me if that's something you're interested in. You and I can hop on a call together and we can talk about, your specific condition and what we can do about to help with your macular degeneration or any other condition that you're dealing with. And finally, if you think that you're ready to come in or try some treatment, then you could give our clinic a call, talk to one of my assistants, and they'll give you some more information about our treatment. We generally do 1 or 2 weeks of treatment, 5 or 10 days, and patients usually come for, they get treatments twice a day. And we do acupuncture supplements, often hyperbaric. We do laser acupuncture. We do electroacupuncture, a whole bunch of different therapies. So that is tremendously useful. And if that's something that you guys are interested in, feel free to reach out and to learn more about our treatment options. That's what I wanted to talk about in terms of what you can do. So you have everything from free education all the way up your tiers. You can keep leveling up to if you're ready to make a full investment in your vision to help recover your lost vision and help keep what you got. And again, we have these different programs set up because everybody's in different situations right now. Blaine and I are also working on, hopefully we're going to have it out by this fall. We're really trying to put together a better home care treatment system or program for you guys, because we know that travel's not always easy. Some of you guys, there's financial and economical issues. So we want to be able to bring this to you guys so you can at least do something at home to help at least slow down and recover some of your vision. So look out for that. That's going to be out pretty soon as well. And Blaine is going to be sending out, we're going to be sending out after this call, we have put together a special offer for you guys who want to get started with some supplements. We have a starter pack of our Macular Generation recommended supplements that we are going to offer for you guys at a discount rate through the weekend, if that's something you guys want to get started on. If not, that's cool too. And you guys just reach out if you have questions anytime. So I know we're kind of creeping up on 8 o'clock. Our time. I want to get some time to get through some of your questions. This is going to be rapid fire. So let me see what we have. Okay. We see questions coming in. Guys, I apologize if I don't get to your questions because I want to kind of keep this tight. If for whatever reason I don't get to your questions, please feel free to email me, post inside the Facebook group. If you guys are not there yet, it is Dr. Rosenfarb's AccuVision community. We have a lot of conversations. We're beefing up content inside that. So that's a great place to open conversations or ask questions. A lot of other people probably have the same questions you have. So it's probably a pretty good idea to get that going as well. Okay, let's jump into the questions. Now, Carolyn, can't get my happiness to do more macular generation, as cannot get to the end of my address all patients now that, oh yeah, triple. So trying to find a Chinese qualified doctor in China. So send me an email on that. I have some Chinese medical doctors that I have co-authored books with. and there's a couple in Beijing and a couple other places. So I read through that quick. I knew the English wasn't so great, but Caroline, please reach out to me if you're in China and looking for somebody specifically there. I do have a few leads for you over there that I can ask about. Miss Julie, how are you? I've been a patient. I've had great success with your protocol. That's awesome. Now I have drusen increasing in size in the fovea in the right eye. Okay, so if there's increased drusen, that means a couple things. One is we need to probably beef up our CBD, our CBD to help break down the drusen. We need to get we might want to go to 2 of the Longevinex, which is the resveratrol supplement we use, and we want to increase vitamin C as well. That may help break it down. More drusen means the liver is not detoxifying, guys. So every time, this in Chinese medicine, I don't want to get too much into this, but those of you guys who have my book know that there's a link between Chinese medicine and vision. This is the link. The link is when our body doesn't detox well, our eyes are not going to detox the drusen. So we need to look at the liver to improve those detoxification pathways when we see drusen is increasing. So we want to look at the breakdown of the drusen as a fat-soluble situation, fat-soluble substance. And basically that can be pancreatic enzymes, or it can be a hepatobiliary issue, maybe biliary insufficiency, or the whole liver is backed up. So we got to look at the liver system to help continue breaking that down. Is there any benefits to pre-vegan? Yeah, vegan's pretty good. Oh, Prevagen. I can't comment on that because I don't know, Harriet. I know what you're talking about. I have not had experience with that specific nutrient, so I'm not going to comment it, only because I haven't had experience with it. But thank you for asking that. Felicia, I've had cataract surgery, and the surgery took away my close vision but enhanced my distance vision. Probably because you had monovision. There is a trend now where they're putting one near and one far lens in to help with the vision. I don't like that. And again, I'm sorry if there's doctors, maybe cataract surgeons on here. I always recommend my patients get clear lenses. The reason I do that is because your prescription will change. And I've seen a lot of patients, the idea is great, but I've seen patients really do bad with the monovision once it's been done. So I would talk to your cataract. Sorry, I got a big itch on my nose. I would go back and talk to your eye doctor, Felicia, about that and see what they can do. Maybe they can replace them with clear lenses so that you're not having this like wonky near far thing. Again, Tamar asks, what are the risks of cataract surgery? Do they trigger wet macular degeneration? Yes, they can. And the reason they trigger that is because the cataract acts as, I'm glad you asked this question, Tamar. The cataract acts as a natural sunglass, and it doesn't allow the UV rays to get to the back of the eye, so blocks blue light rays. So you have this built-in sunglass, you take it out and you put it in with a clear lens now. Now, all of a sudden, all the UV rays and the blue light is getting to the back of the eye. It's like you're getting like sunburn on your eyes. Right? You're getting this radiation stress to the macula and retina that it hasn't been dealing with. So what we do to handle that is we have our patients load up on carotenoid antioxidants prior to treatment, make sure the carotenoid antioxidants are high so that they have this protection of the retina. We also highly recommend that patients use UV radiation, basically UV sunglasses, always blue light glasses post-op in front of the computers. And we really recommend patients try to do this in the winter. Why? Because there's more strong sunlight in the summer. So if you can, it's the best idea to try to get cataract surgery in the winter. And if you're going to get it in the summer, like stay inside, like don't be out in the sun, don't go to the beach, don't go out on a boat right after you've had cataract surgery. Even the winter, being out in the snow, there can be reflective, UV light bounces off reflective surfaces, so you can have problems there. Lastly on that is make sure that you have a cataract surgeon for sure who's had experience working with patients who have macular degeneration. And that is the mechanism for that. Thank you, Tamar, for asking that. Great question. Do you have any way to test oxygen flow to the eyes? Yes, we do, if the eyes are working. Basically, the method for that would be an ocular Doppler. okay, which measures blood flow to the eyes, which is, it's expensive equipment. We don't really use it. But what I do like, which we're actually looking into getting, is thermography. Thermography is a device that's pretty much used for pre-detection of breast cancer. It's used more a little systemically now, but it's a great way to measure blood flow. So blood, remember, red blood cells are what carry oxygen to the eyes. So reduced blood flow is going to result in reduced oxygen or hypoxia. So the direct measurement of blood flow to the eye is going to suggest or be indicative of the oxygen levels. It could be systemic, right? We could have anemia, where there's systemic hypoxia. Anemia means there's low blood volume in the body, or it could be local because the pipes or microvasculature, blood vessels to the eyes, are either blocked or the vasculature is broken down. Okay. Next question. Harriet, again, systolic heart murmur, doctors swore that was not serious, might cause. Yes, again, the heart pumps blood, head is above the eyes. If we're on, guys, even, and again, talk to your doctors. If you guys are on antihypertensive medications that are dropping your blood pressure too low, it reduces the contraction. So you can have, whether it's a murmur or antihypertensives or even low blood pressure. Some of you guys have low blood pressure. That you're not getting the blood flow you're not getting the blood flow because the heart's not pumping hard enough up to the eyes. So whether it's a murmur, hypotension, medicine induced, or if that's how your body runs, or you're not getting this heart contraction that's getting a good pump up to that, because we got gravity, right? The head is above the heart. So that can absolutely contribute to that. And it has a lot to do with the pressure of the heart's contraction. So thanks for asking that, Harriet. Marlene asks, what is the reported percentage of adverse eye effects with the vaccine? I do not know that, but I have seen quite a few in clinic over the last 3 months. I've had a lot of patients come in with varying eye conditions, glaucoma, macular degeneration, retinitis pigmentosa. I have unfortunately seen an increase in eye strokes because of the blood clotting. For those patients, we're getting them immediately on hyperbaric and acupuncture and supplements. We're getting them on things like serrapeptase to help break down the clots. A lot of them are also going to get the injections concurrently. Again, guys, we are not against Western conventional biomedicine. We're integrative. I promote integrative medicine. Why? Integrative gets the best clinical outcomes for patients. We want to work together. It's not Western medicine's better. It's not alternative medicine's better. We need to work together, folks, to get the best outcomes for you and your family members. Okay, next question, Vinita. I live in a high altitude and occasionally take chlorophyll. Great to help with oxygen, help with my breathing. Can chlorophyll help? Absolutely. Chlorophyll mimics the red blood cells, so I'm a huge fan of chlorophyll. I'd also recommend you level it up with things like blue-green algae, wheatgrass, spirulina, chlorella. Those are incredible purifiers to the blood. They help the body to deliver oxygen at a better rate. They alkalize the body. Anything you guys do with greens is amazing. I'm a huge green fan, whether it's green leafy vegetables, spirulina, chlorella, blue-green algae, chlorophyll. Yes. Huge fan for that. Specifically, the chlorophyll is the blood of plants, right? Of leaves, and that's what gives the plants their green pigment. But that is the synonymous like red blood cell of plants. So it's very, very useful for us as humans. Okay, another question. Do you think amber yellow colored glasses can help block out? Yeah, those are blue blockers, right? You guys remember from the 80s and 90s, those big giant blue blocker glasses that you used to have infomercials from? Well, they've gotten a lot better and a lot cooler looking. So go on Amazon for like $20, or you can go to your opticians and have them put the blue light coating on your lens. That's what my glasses have. We are in Westfield, New Jersey. That's where our clinic is located. Our website again is acuvisionacupuncture.com. That is our main site. We have our eyehealthinstitute.com. That's where we sell our books and our supplements and our online courses for acupuncturists. Mr. Edgar has a question. When I called your clinic for red detachment, that we usually recommend surgery, yes. So for retinal detachments and strokes and anything that's emergency, we will not see you unless you've been cleared by your ophthalmologist, retinal specialist, or retinal surgeon, whatever. You have to be stabilized. So like they got to put the retina back together. What we will do is help with the accelerated recovery and more complete recovery. Anytime there's retinal detachments or eye stroke, that is an emergency situation. We want you guys to get put back together as fast as possible, but we want you guys in clinic. We want you in hyperbaric as fast as possible. We want you on supplements, and we want you to get acupuncture as soon as possible, because with those conditions, we consider those traumatic situations, there is a window. All right. So the sooner you get in for those treatments, the better. Not the case with all. Of course, we want people to get in soon, but if there's been a traumatic retinal detachment, eye stroke, CRVO, retinal vein occlusion, or anything like that, that is time sensitive. We want you in as soon as possible. Whether you're working with me or anybody else, you're going to look for hyperbaric, get on it. Time is wasting. Next question. With beets, does it matter raw, cold, or cooked? No, I like raw beets just because I like the fiber and everything like that. Juicing will be a lot of sugar. Cooked is good, lightly steamed. I wouldn't overcook them, because when you overcook any vegetable, you start to lose a lot of nutritional value. So maybe lightly steamed. Certainly juiced would be fantastic. Hope that helps. Mr. David, diabetic retinopathy and wet macular degeneration similar? Yes, they are similar, and I have a lot of patients who have both. The similarities, they're both like microaneurysms where there is active bleeding. The cause is different, but the presentation is the same, and the treatment's the same. Conventional biomedicine will also give Eylea injections for that. Of course, we're looking to manage blood sugar. So yeah, it is also diabetic retinopathy. We're going to have a whole talk on that as well. So I don't want to get too much into that, but yes, we need to manage blood sugar. The fluctuations in insulin are going to cause tremendous amount of stress and damage to the vasculature, which is why diabetics are at increased risk for strokes and heart disease and heart attack. So yes, that is an indication. It's an early warning sign if you have diabetic retinopathy and bleeding that could happen in the brain or other parts in your body. So we definitely want to get that under control. Next question, Miss Bev. Will you be selling home microcurrent units? Yes, we will. Blaine and I are working on these right now. We have our patents coming in soon, hopefully within the next month. We've been working on this for 2 years. We have part of our home care strategy. We are basically using the German technology of alternating current stimulation. It is an upgrade of the microcurrent stimulation that's been used since the 80s. Very, very excited about it. We're going to actually, when we get it in, we're first going to be doing a clinical trial, which I'll talk to you guys about when, probably in the fall when we get that going. But we are going to be looking for subjects to come in and go through a clinical trial where we're going to test people's vision. Obviously want to make sure it works. We're not just like, going to say, here, use this. So we want to obviously make sure we have clinical efficacy before we put it out and offer it to you guys. So we're going to do a clinical research study, test vision, have you guys do some treatments, and then retest vision to confirm efficacy and that it is safe and effective for you guys, which we know it is, but got to test. Next question from Miss Kathleen. Can the liver easily metabolize Canavision Hempo? With ease, it actually is a lubricant. The CBD full spectrum Canavision that we use will actually help improve and thin out the bile as a phase 1, phase 2 liver detox enhancer. So absolutely great question. Any correlation with gallbladder removal? Yes. Gallbladder removal reduces the amount of bile, right? Gallbladder stores bile and also releases bile. We know bile helps emulsify fats in the body. So less bile, less fat capacity to less capacity to emulsify fats. So yes, so in those cases where the gallbladder is removed and we see increased cholesterol, increased fatty deposits on the body, we may recommend things to help the body produce more bile, or even synthetic bile like Tudka or ox bile or something like that are supplements we recommend for that. So that's that. Tamara, another question. I developed dry MD 9 months after iron intravenous. Is there any connection? Yes, because Iron increases is oxidative stress. More oxygen in the body. If there's too much iron, that means that there is going to be more oxidative stress without question. So again, I have not seen your condition, but if I had to guess, I would say the increased oxygen load on your body increased the oxidative stress levels, which accelerated the macular degeneration. So we want to look at specifically with your case, the inflammatory and oxidative stress markers and what's going on with that. We'd start by looking at your CBC, looking at iron and going through a functional analysis of that. Next question, Christine, my sister has terrible vision in youth and now has tachycardia, I think, but she never smoked, doesn't really drink. Eyesight is deteriorating, more low blood pressure. Yeah, because she's not getting the blood flow up to the eyes. No cholesterol issues, diabetic. So this sounds like a hypoxia issue, low oxygen, low nutrition. So this condition, Christine, would be more of a malnutrition, starvation, suffocation. So again, we need to look into, it could be genetic because family has it, as you indicated, but we have to look at the underlying factors that are driving this specific condition. Again, guys, we have protocols, we have supplements that are going to be tremendous, but you guys are all individual. We need to look at your case individually, which is why we have patients come in. So of course the supplements are going to help. Of course, all the recommendations are going to help. But if you really want to dial in, you have a complicated situation, consider either telehealth or, coming into clinic and working out, working with me. We need to get more specifics on that. But yes, definitely sounds like in your sister's case, it's a malnutrition, hypoxia situation that we want to dive deep a little bit more into. Next question, Mr. Nick. What do you think of microcurrent? We talked about it here. My experience with the current microcurrent devices, of which there are many, my experience is it works about 50-60% of the time. And again, there are specific reasons for that I'm going to get into when I give a whole presentation on microcurrent. Some people respond great, some people don't. There are reasons for that. And the home care strategies that we do that we're going to get you guys on, that is going to include our alternating current stimulation microcurrent device, is going to improve your likelihood of getting it, because we now know why some people respond and others don't. And guys, people who have too much inflammation and are dehydrated, that's one of the things that we've noticed. So some of the people who have a hard time with it is because water conducts electricity. If you're dehydrated or if you're too inflamed and too dried out, it's not going to work. Or if you have too much dry eye. So we may have some nutritional protocols that we're going to want to have you get onto for 3 months before even starting home microcurrent therapy. So there's a lot of that. Which brand of Resveratrol? Next question. We like a product we have on our website. If you can find it cheaper, get it on your own. I like a product called Longevinex. They have a lot of research behind it. That's the Resveratrol product that we use. Of course, Resveratrol is also found in red wine. That's right. That's why we use red wine with meat. Traditionally, nice Italian dinner, you have red meat, little red wine. Why do we have red wine? Because the red wine has resveratrol, which breaks down animal fat. So it's going to break down the drusen in the eyes, also help with your cholesterol if you have high cholesterol. Green tea is also very good for breaking down drusen and cholesterol and managing blood sugar. Again, those of you guys talked about diabetic retinopathy, get on some green tea. That helps a lot. What do I do if I have a mitral valve murmur? Excuse me. Is there a solution? Yes, that is a little bit of a separate issue. That's more of a cardiovascular issue that we'd have to talk about. Murmurs can be supported and treated, but that's kind of like a different situation. But yeah, we can, if you want to reach out to me, we could talk about that. What is good for floaters? Again, we have to source what's causing the floaters. Is it blood flow? Is it inflammation? Is it poor circulation? Is it oxidative stress? Is it hypoactive macrophage activity? What's driving the floaters? So generally, we recommend our LipoVision DHA product, which is omega-3 DHA, and hyaluronic acid tablets. So those will help a lot. Also increase your hydration in the Vision Mins, which is magnesium, potassium, will help with the floaters. Next question, Ms. Judy. We're getting down to the wire here, guys. Thanks for your patience. Once you have a scar on your macula, is there anything you can do about it? Absolutely. There's a lot we can do about it. One of the products we like for scarring and to prevent scarring, to help support the ocular microbiome, is MSM eye drops. Those are also on our Eye Health Institute site. You put a drop in each eye 2 or 3 times a day. It will help reduce scarring. If you've had glaucoma surgery, trabeculectomy, if you had LASIK surgery, if you've had eye injections, anytime you do an eye injection or eye procedure, there's going to be scarring. Anytime you've had an issue with your eye, edema, a bleed, a rupture, a microaneurysm, fluctuating eye pressure, you're going to have scar tissue. MSM eye drops, absolutely mandatory for that. Okay. Super, super easy. Next question, Adrian, please say more about the benefits of hyperbaric oxygen treatment. Adrian, a little bit tight on time. Again, the long and short is the retina is the highest oxygen consuming tissue of the body. We want to get as much oxygen to the body as possible, specifically to the retina. Go to my YouTube page, our YouTube page. I have a 2-part series on hyperbaric oxygen specifically for eye conditions. It's a 2-part series. The first part, we talk about what hyperbaric is. The second one, we talk about hyperbaric specifically for eye diseases and how it works. Watch those videos. Please reach out to me if you have any questions. There's specific protocols. There's specific atmospheres that we recommend. I recommend soft, mild hyperbaric for most of these eye conditions, unless it's an eye stroke, mainly because the high hard chambers will accelerate cataracts. Soft chambers, mild hyperbaric will not cause cataracts or myopia. A lot of people have also had acute myopia when going into 2 or 3 or higher hard chambered pressured hyperbaric. So for most of these conditions, I do recommend the mild hyperbaric or moderate hyperbaric, which is generally the 1.3 to 1.5 atmospheres. Next question. I have called and left a message to your office. I would love to have an in-person appointment. Absolutely. Just reach out. We could probably do a telehealth consult if you are distance for sure. We can absolutely set that up. Next question. Traumatic injury to your eye I had an ICL operation. Yes. Any surgery to the eye I would consider a traumatic injury. All right. Whether it's surgery, you're still going to have scar tissue. Even if it's old, you still can do some work to help it. All right. As I said earlier, there is a window, but I've learned to never say never. I've had people come with eye strokes 10 years ago. I've had people with car accidents who, had problems, who start to gain some vision back. So it's always worth a try. Look, the greatest thing about these therapies, acupuncture, Chinese medicine, functional medicine, naturopathic medicine, guys, you can't do harm. Right? You can't make the situation worse. Well, I guess you can if you don't know what you're doing. And the biggest question we get with the acupuncture is, do the needles go in the eye? No, they don't. Most of the acupuncture points, hands and feet, around the forehead, back of the neck, sometimes back of the head. They don't go in the eyes. We treat little kids. We have AccuVision Junior programs for kids who have like juvenile macular degeneration called Stargardt's, needle-free techniques all the way up to our patients who receive needles. So that is that. Yes, operation, any traumatic injury, operative, inoperative, stuff like that. I asked about Chinese herbs. Yes, Chinese herbs are going to be specific for the condition. Of course, Dave asked Chinese herbs. Again, there are specific Chinese herb formulas that are good for vision. The best practices of Chinese herbal medicine are used when we have specific Chinese herb that are going to be tailored for your specific condition based on what we call in Chinese medicine, your pattern, right? You have a pattern of disharmony that we're going to check your pulse, look at your tongue, ask you questions, find out what is unique to you. In Chinese medicine, you could have 10 patients with macular degeneration, but they'll be on 10 different Chinese herbal formulas because they have different things going on. They have different genetic predispositions, different constitutions. Some have hypoxia, some have inflammation, some have more drusen, some have diabetes, some have cardiovascular disease, some have too little blood flow and nutrition to the eyes causing macular degeneration. Some are on screens all the time, so they have radiation stress. So we really look at the specific conditions, what's going on. But thanks for asking that, Dave. Coming down to the wire, a couple more questions. Mr. James, Nitric oxide, good supplement. Don't need to. Just supplement with beets. Beets is the best way to get it up. And get it up. That was kind of a Freudian slip. Yes, nitrous oxide in beets is also used for ED, erectile dysfunction. So little tidbit there for you guys. Are dry eyes caused by dehydration? Yes, we're going to do a whole section on dry eyes, but yes, can be caused by dehydration, can be caused by low water, low mucus, or low fat or lipids, or a combination, one or a combination of those, or too much inflammation. Tune in about a month, in about 3 weeks, about 6 weeks, I think, 4 or 6 weeks, we're going to do a session on dry eye. So be on the lookout for that. We have a lot of information. Dry eye is arguably the easiest thing for us to treat in Chinese medicine. I've had one patient that did not get results with dry eye. One of my favorite things to treat because it works so well. And we have our LipoVision eye drops, our LipoVision and Vision Mins that we use for that. Myopic macular degeneration. What are my thoughts? We have tremendous results. I've seen dozens of cases of specifically myopic macular degeneration as compared to age-related macular degeneration. Again, we have to identify specific based on each individual what the driving factors are. That means we do a full analysis, a full audit of your system. We'll ask questions. We will look at your body to find out what is driving specific to you, right? We know we talked about inflammation, oxidative stress, hypoxia, blood flow, but what on top of that? Are there thyroid issues? Is your diet? Are you stressed? Like, we have to look at you as a person and figure out specifically what's going on with you so we can fine tailor the treatment so that look, guys, I could do acupuncture on everybody. I could have protocols, give everybody AREDS, give everybody the same acupuncture protocols and everybody the same supplements. What's going to happen? We're not dealing with the unique specific causes that are unique to you. And if we don't address those, guess what? It's going to come back. Right? Because it's going to help slow things down. You may have vision improvement, but this is why our patients who come to see me in clinic get the best results. Why? Or we do telehealth, because we get very specific and we dial in so exclusively on what your specific issues are, and we manage those because we manage the driving factors that cause macular degeneration. That's when we get real traction with these conditions. Okay. A couple more questions. Fuchs, yes. So Fuchs is different. Somebody's asked about Fuchs. That is a corneal erosion issue. Again, I'm going to do a whole thing on lens issues and corneal issues. So stick with us. No pun intended, but shoot me an email on Fuchs, but we are going to have a section on that. I have dozens and dozens of patients that I've worked with Fuchs. We've recovered. Sometimes you need surgery, but we've been really, really successful with the progressive degeneration in dealing with that. Is often an autoimmune situation. Posterior vitreous detachments. Somebody's asking about that. Yes, we see a lot of that. Again, that is just, we call that traumatic, and we use specific supplements to help repair, acupuncture, hyperbaric. But again, we need to look at the factors that are driving that. Why specifically did that happen to you? And what are the risk factors that it could happen again? Same thing, all right? We need to control risk factors. Last question, Miss Mary, did you mention Neurovision as one of the macular degenerant supplements? Neurovision is useful, but I generally use Neurovision if there's a lot of inflammation and if there is optic nerve or brain issues. So the Neurovision focuses a little bit more on the brain and inflammation. Okay, so if I realize or there's been some brain involvement or a stroke, if there's been any eye stroke, I'm definitely using our Neurovision product. And Canavision can take the place. We were out of Neurovision for a little while. Now we have it back in stock, but Canavision will act in the same way, similar as an anti-inflammatory. Again, we're talking about Canavision CBD as being the primary supplement that we use right now to help control metabolic or immune-mediated inflammation, whether it's autoimmune, whether it's metabolic-driven. Guys, CBD, high-potency CBD, our product is Canavision. So real quick, so ours is 2,500 milligrams. You guys can probably see that. We just increased the potency to 5,000. Now, if you guys can find It's kind of a pitch here a little bit, but if you guys can seriously find a 5,000 milligram full spectrum CBD for cheaper than we have, please go get it. And you've sourced it, you have the COAs, meaning they've done the testing, feel free to get it. I can guarantee you're not going to find a better price on the CBD. We have a 5,000 CBD, which is double the 2,500 that we're offering on the website now. So if you guys are using the CBD and the Canavision, it is an expensive supplement because it's costly to produce. Hemp is just not cheap. And there's a lot that goes into the manufacturing. So we have the 2,500 and we do have the 5,000 available now for those of you guys who are interested. Again, the 5,000, same thing. It's going to last twice as long. So that's it. That's all we have for our questions. Guys, I wanted to say thank you so much. I know we went a little bit long in this, but I saw we had a lot of questions. I really wanted to get to them. Please, please, please reach out to us. If you have questions, call our clinic. You could email, use Facebook, our Facebook group if you have questions. All these sessions that we do are recorded. They will be emailed out to you. They will be posted in the Facebook group as well as our YouTube page. Please, 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 we are asking that you send them out to patients that you know, or family or friend members, or just people you meet that you know that may find some use value in these. We don't do a ton of marketing. We don't do a lot of advertising. Most of patients come to us through word of mouth. My mission is to really get this information out. Look, there's a lot of people who were like, hey, I was diagnosed with macular degeneration or any eye disease. I'm just going to wait for stem cell or gene therapy or whatever. And that's fine, or they've just resigned to the fact that they're losing their vision. No problem with that. My problem is that patients who are diagnosed with these conditions and told for whatever reason that there's nothing available to them and they're going to go blind. Just keep coming back and we'll tell you how fast you're going to go blind. I call bullshit on that. Seriously. There's so much, after we've shown you tonight, there's so much that can be done to help both recover and preserve vision as it relates to macular degeneration. So anybody who has been told that there's nothing they can do, totally disagree. And I know that because I've been doing this for 25 years. And does it work for everybody? No, but everybody can find benefit. It will at least slow the progression with everybody who's got macular degeneration. Not everybody will recover vision. 90% of patients will, 80 to 90% of patients will, but everybody will be at least able to slow down the progression of their vision loss. So thank you so much. I appreciate you guys for joining us. We had just under 600 people register for this call from countries all over the world. So thank you, thank you, thank you. If you're watching this on a replay, again, please feel free to reach out to us. Check our YouTube page, check our websites. Again, through this weekend, we're going to have the offer available. Go to Eye Health Institute. We are also going to send out a link by tomorrow with the information for the starter pack for macular degeneration. And have a great evening, guys. Thanks so much for joining us. Take care. We'll see you next time. Bye-bye.